Hello everyone, how are you today? I am Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. And as you know, I make videos about health and healthcare topics, and all my videos are directly referenced from the US National Medical Library or very renowned medical site. Today's database, today's information is referenced from the WHO website directly. So guys, as you know, we have an acute crisis situation in Kerala. There is a lot of flood there, and a lot of flood poses a big risk of communicable diseases. It poses a big risk of waterborne diseases like typhoid, cholera, leptospirosis. It causes a risk of hepatitis A. There can be a very big increase in waterborne diseases like malaria, dengue hemorrhagic fever, yellow fever, and even West Nile fever. So all these diseases are a big risk to the health of the people in Kerala and around the area. So that's why it's very important for you to share these videos to all the people in Kerala and South India, so that they know what and how they can prevent these diseases from their area. So today we are going to talk about all these things, and we are going to tell you how should you prevent these diseases to spread, and how can you protect your health during the crisis situation of a flood. So don't forget to share these videos, and don't forget to subscribe our channel.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So guys, as we talked about flood and communicable diseases, there are certain measures, preventive measures which you can do. And communicable diseases risk from flooding can be greatly reduced by doing these things. So there are two kinds of measures. One are short-term measures and one are long-term measures. So in short-term measures, what is recommended is you need to chlorinate the water. During these times of flood, it's very important to ensure uninterrupted provision of safe drinking water. So in order to reduce the risk of outbreaks of waterborne diseases also, this is important. So how can you do this? How can you chlorinate the water? Free chlorine. Free chlorine is the most widely and easily used substance and the most affordable to actually disinfect the drinking water. It is also highly effective against nearly all waterborne pathogen except some few, right? Except Mycobacterium and except Cytosporidium parvum cyst. So apart from that, many of them it's very effective. So what are the doses? At the dose of a few milligram per liter, it actually the contact time is of 30 minutes. So free chlorine generally inactivates 99.99% of enteric bacteria and viruses. So that's why free chlorine is very good in these kind of situations, right? A few milligrams, 2, 4, 5 milligrams per liter is enough, and it needs to be kept for 30 minutes, right? For the point of use, household water can be treated, and the most practical form of free chlorine are liquid sodium hypochlorite, sodium hypochlorite, and solid calcium hypochlorite. Bleaching powder can also be used. Bleaching powder is basically a mixture of chloride of lime and which is a mixture of calcium hydroxide, calcium chloride, and calcium hypochlorite. So that's actually where you can find these kinds of chlorine, free chlorine. See, the amount of chlorine needed depends upon mainly the concentration of inorganic matter in the water. So, and this has to be determined by each situation. But after 30 minutes of residual concentration of active chlorine in the urine, the water should be the residual. But after 30 minutes of chlorination of the water, the residual concentration of active chlorine in the water should be between 0.2 to 0.5 milligram per liter, which can be determined using special test kits which are available in the pharmacy or in the chemist labs. So basically chlorination, free chlorination is the best way to actually prevent waterborne diseases during the crisis situations, and the government, the local authorities should take initiative of doing these things and providing clean chlorinated water to the individuals. So that's the first biggest step. Second step is to prevent hepatitis A by vaccines. Using hepatitis A vaccine for mass immunization is actually not recommended, but vaccination of high risk groups is important, right? Such as persons who are actually involved in the management of drinking water, wastewater or sewage. These people needs to be vaccinated of hepatitis A. In case of an outbreak of hepatitis A, consider immunization of the contact, anybody who comes in contact, and the use of immunoglobulin is not recommended. So the diagnosis of hepatitis A, acute hepatitis A, is confirmed by one test. It is called anti-HAV IgM antibody. So IgM is an acute phase antibody. So if that is present, you have acute hepatitis A. If IgG antibody, anti-HAV IgG antibodies are present, you have past history, or you might have a recent few weeks back hepatitis. So that's the test which you can do to check if you have hepatitis A, and vaccination. You can get vaccinated. Everybody is not recommended. Only those who come in contact with sewage or contaminated water should get vaccinated. Then malaria prevention. To prevent malaria, insecticides. The flooding does not necessarily lead to an immediate major increase in the mosquito numbers, and there may be time to implement preventive measures such as indoor residual spraying, or you can retreat or retreatment of distribution of ITNs, insecticides in the area. By there, because if it is known to have mosquitoes, you can do the retreatment. This will also have an effect on the other mosquito-borne diseases, right? And early detection is important if malaria is seen in some areas. It is important to track weekly number of cases needs to be tracked in that area, in the hospitals nearby. Records needs to be kept. Provide laboratory-based diagnosis needs to be done. Then free medical care with artemisinin based combination therapy should be provided with a falciparum malaria epidemic. If it is confirmed, only if it is confirmed, then a free malaria care should be provided by the government, and an active search for malaria cases may be necessary to reduce the mortality in remote areas with reduced access to healthcare services. So that's the actual way of preventing malaria, right? And the most important step is health education. You need to understand that promotion of good hygienic practice, ensuring safe food preparation techniques, ensuring whether the people are boiling and or chlorinating the water or not, that has to be ensured. Vital. It is of vital importance to actually early diagnose and treat diseases like malaria within first 24 hours of onset of fever. That's why testing should be done. Anybody who has fever, test for all these foodborne, waterborne diseases. It's very important. Malaria, typhoid, dengue, cholera, right? And many other, you have to test for all these diseases. Then if there are actual corpses, if there is a lot of, damaged area, people have died, a lot of corpses are there, then handling corpses is also a very big issue during these situations. So in acute short-term measures, it is preferable for cremation of these mass casualties where identification is a problem. That is one method. Cremation is the method which should be there. And for workers that routinely handle corpses, the thing should be that graveyard should be at least 30 meters, at least 30 meters from the groundwater source, which is a source of drinking water. So what are the long-term measures? Long-term measures in such situations are all about legislative and administrative issues. Long-term measures to handle these kind of crises are about legislative and administrative issues. You need to create a disaster preparedness, a program and an early warning system which warns the people that such kind of an that warns the people that such kind of an issue is about to come or have started, so that they can prepare. And you should actually create a program to educate them, right? Improve your surveillance on local, national and international or even global level, so that you can know if such kind of issue is happening. Promote tap water quality. You should promote the regulation on these tap water qualities, and even the monitoring should be done on these kind of tap water qualities. Then people then administration should enforce high standards of hygiene in these kind of situations, right? So that is very important. Then improper water treatment and sanitation is the base, is the key here. Keeping infectious diseases in control, creating a program to keep these infectious diseases in control is important, and which needs to be active and effective in these situations. So these are all the things which can be done in short term and long term prevention of communicable diseases during a flood. So I hope this was helpful, guys. So start taking water very seriously. What you drink during these times, either drink it after boiling or add a little chloride to it and wait for 30 minutes, and then again you can drink it or you can boil it. And most important, get vaccinated for flus, influenza also, hepatitis A also. So that's very important. So guys, that's all about today's video. Hope you like the video. Don't forget to share this video, especially to the South Indian people, and make sure to take care of yourself during such circumstances, right? That's all for today, guys. I hope people in Kerala can see this video and actually take care of yourself, hoping for the best of them, to have the best of their health, and so that they can save whatever they can. So that's all for today, guys. Hope to see you tomorrow with another video. Take care, and thank you so much for watching. Stay connected, stay healthy.